What is your most embarrassing doctor story? I was at the eye doctor. He was examining my eye and he said, "Okay, now open wide." I opened my mouth as wide as it would go and waited. An uncomfortable moment passed before he said, "I meant your eye." This is by far the most adorable mistake in this thread. My husband gave me permission to post this. He went in for back surgery and in pre-op, they asked him if he was allergic to any medications. He said that he had an intolerance to Phallic, an antibiotic, which caused him gastrointestinal issues. The surgeon said that they were going to try to use Phallic anyway, since he didn't have a true allergy. With him having back surgery, he had to be on his stomach with his ass in the air. Apparently, in the midst of surgery, my husband crapped all over himself and the surgical team. He woke up towards the end of the surgery to a horrid smell and the nurse saying, "Well, we should have listened to you." Ha, suckers earned that one properly. I was 15 getting my balls cupped and coughed for a physical. The doc held my balls in his hand and asked me to flex. Confused, I focused all my energy in my dong muscles and made the little fella bounce a bit. The doc laughed his ass off and said, "Oh no son, I meant flex your muscles, like you're lifting weights." Whatever, his loss. But doctor, this is how I lift weights. I was working at Best Buy. This was the early 90s, back when the store layout was much more heavily based on tall aisles and stock was stored on top of the aisles. We had to load and unload that stock and somehow, I had managed to strain hard enough during one of my shifts that I gave myself a case of hemorrhoids. Now, this was long before WebMD and I wasn't exactly educated about such things, so I dealt with it as long as I could, until one day I went to my mom and told her what was happening. She promptly took me to doctor to get everything checked. As soon as the doctor took a look he said, "Okay, this thing is about to burst. We need to cut it out." I'm sorry, what? Cut what on who? He then turns to the doctor's assistant who was also in the room and says, "Can you get Kelly for me?" Obviously, I'm not thrilled at two people already having peered deeply into my soul from the bottom up, and I'm not really keen on a third observer. The doctor then proceeds to tell me what is about to happen. "We can't give you any anesthetic. The blood vessels of the anus are too small and anesthetic may cause clotting." I'm not sure if he said clotting specifically, but there was some risk of complication. The door opens and in walks Kelly, who is a probably 6'5" and 240 pounds. I then learns that Kelly's job is to help spread my butt cheeks apart and hold me still while the doctor cuts out the hemorrhoid. Now one might assume that having a large man hold my butt cheeks apart while my ass is sliced up is the embarrassing part, but not so much. After the doctor finishes with the stitches, the nurse comes in and hands me a maxi pad. What is this? The doctor then tells me, "Well, you're going to be bleeding for a while. You should put that in your boxers to catch any spotting." And that's how I came to wear maxi pads for almost 2 weeks during my senior year of high school. To be fair, the maxi pad was probably more comfortable than a tampon would have been. When I was around 14, I went in for something bladder related. Honestly, I hardly remember it. What I do remember is the doctor shoving a tube up my pee hole. The whole time I was thinking, oh god, don't get a boner, oh god. WELLLL. I got a boner. It made the whole tube in my dong thing a lot more painful and embarrassing. Getting a boner makes the process a lot easier. Most nurses would thank you for it. When I was at the hospital giving birth to my son, the doctor broke my bag of water. They saw meconium, first baby poop, in the amniotic fluid, so they started flushing me out. The baby was blocking the exit, so the fluid they pumped into me wasn't coming back out. I remember them saying, "We aren't getting any return." It came time to push, and the doctor must have known what was coming, because when I looked up after his head was out, she was dressed up like the Gorton's fisherman, head to toe rain gear. The moment his shoulder came free, any leftover amniotic fluid and all the fluid they filled me up with, let out in one giant birthing liquid tidal wave. The entire birthing staff went whoa and jumped back. It was a remarkably wet entrance into the world for my son. She was dressed up like the Gorton's fisherman. Let's do this crap. I dislocated my shoulder in a snowboarding accident and in the air was freaking out when the doctor walked in to put it back into its socket. So the nice nurse, with a huge rack, came in to help comfort me, read, hold me still. Before the doc even started, I was squirming like a baby and I started to feel cozy and happy. thinking maybe the painkillers had finally kicked in. Turns out I was nuzzling the nurse's breasts with my face and really enjoying it. When I realized what I was doing, I quickly peeled my face away and apologized frantically. She said it was alright. I'm a girl. So I was 16 when I lost my virginity. I didn't use condoms and I went down on her without any protection as well. I had just taken all the horrific, although necessary, sex health courses at my high school. About a week later I had 2 white bumps on my tongue, and they kinda hurt. Needless to say I was scared as frick and was thinking I had some incurable STD. I go in, tell the doc I had sex for the first time and didn't use protection and then showed him the bumps. I opened my mouth, and he flashed a light in my mouth. He said okay, and gave me a very stern look. Then he burst out laughing and asked me if I had eaten anything particularly hot recently, which might have burned my mouth. Motherfricking fried chicken. I had burned my tongue, but nothing showed or hurt for a while. He told me to go home and to start using protection. TLDR got herpes from a chicken. That TLDR just made the entire post for me. Went in to get my blood drawn for some reason when I was 18 or so. I kept flexing my forearm when she was trying to put the needle in one of my veins and it didn't work correctly and blood started flowing freely out of my arm. Then she tried my left arm and I felt like I was about to pass out. Woke up on the floor covered in my own pee. It was pretty embarrassing walking past everyone in the office, waiting room, and parking lot with pee-soaked pants. I work as a phlebotomist. If it makes you feel better, this happens. Don't worry about it. Also, the only reason blood started flowing out of your arm is because the girl messed up. Sorry you had to go through that. I know it can be hard sometimes. When I was about 14 I crashed my bicycle going down a little hill. It wouldn't have been a big deal, but the shorts I was wearing had zippered pockets. When I fell, the toggle on the zipper dug into my hip and as I slid down the hill it dug a gash about 3 inches long into my leg. I go to the urgent care center with my father an hour or so later because I needed stitches. This was an unfortunately common occurrence for us for a while in my teens, and instead of the usual wrinkly old doctor that normally sewed me up, I was given over to his new, young, very attractive female medical student. Because of the location of the gash, I had to remove my shorts and underwear so that she could get at it and I was given a small washcloth type thing to protect my modesty. So she set to work sewing me up, leaning over the top of me, her boobs pressing into the side of my leg, her breath slowly blowing over my cloth covered loins, and I couldn't stop it. I got that feeling. You know, the 8 AM math class hot girl sitting next to you in short shorts better move the textbook to my lap feeling. Sure enough, after about 20 stitches the cloth starts to swell, and then peak, and then push to the side. I was panicking. I tried to figure out how to get a hand down there to fix the cloth. I tried to think of my grandmother mid-coitus with a hairy leprechaun. I tried not to think about sticking it directly into her mouth. Nothing worked. For the better part of 45 minutes I lay there with my erect penis not a foot away from her head almost completely exposed. 8 AM math class hot girl sitting next to you in short shorts better move the textbook to my lap feeling. I feel you homie. When I was 18 I had a lump on one of my testicles. I went into my normal family doctor to check it out and he said we needed to get an ultrasound on it to make sure it wasn't cancer. Scary crap for an 18-year-old boy, or anyone, really. So, I went to the imaging center, did the paperwork and went into the room and sat on the table. After a couple minutes of waiting in comes the nurse. She was blonde, probably about 25 and was smoking hot. She told me to take my pants off, lay down on the table and spread my legs a bit. I instantly started feeling that familiar tingle down low and knew I was in for some trouble. She rubbed the jelly on the ultrasound camera and then put a little on her fingers and rubbed it onto my balls. Feels good, man. She gently flipped my penis up and covered it with a towel so that just my scrotum was exposed, and that did it. I had a full-fledged hard-on within 6 seconds. My face filled up with blood. I was so embarrassed, and of course she knew. I tried to take my mind off of it by asking her questions about the machine and how it worked. Did you know that they can place the cursor on the screen onto the image of a vein or artery and the machine will only pick up sound for that specific part? After about 15 minutes of her slowly rubbing that plastic tool all over my nuts she finished up and said, well, your testicles are healthy. just some blockage in the vas deferens, and then she told me that masturbation should help clear it up. It did. That's when you ask for a demonstration. I started laughing hysterically when my doctor said rectally. One day my left ovary just starts hurting like a mother. Like this is serious business, I'm going to stab someone so they can feel my agony type pain. I go to the doctor and apparently I need an ultrasound. Alright, fine. But wait, here's the best part. It's an intravaginal ultrasound. For you Y chromosome transports out there, what this means is that they take this big cyberpunk dildo, shove it right the heck up your cooter and then sort of root around in there like it's a freaking grab bag. So as part of their here's how to make this suck less packet, the hospital includes pretty specific instructions to drink 3 bottles of water an hour before your appointment, without going to the bathroom, so that they can tell which fleshy sack of muscle is your bladder and which is your uterus. Being the good little patient I am, I did exactly that. So I go in there, gotta pee like a racehorse, but I'm holding it in through sheer willpower. Soon the radiologists got her magic wand up my snatch and I hear a whoa. I'm like, oh heck no, what the frick is there to woe about in there? She turns the ultrasound screen towards me, points at this enormous black shape and goes, how much water did you drink? I tell her I drank 3 bottles, like the sheep told me to. She gives me this wide-eyed look. Apparently they put 3 bottles on the instructions with the assumption that people would only be able to drink like 1 or 2 and would stop when they couldn't handle anymore. Not me. I powered through that crap because when the guys with PhDs tell you to do something, I like to assume it's because they freaking mean it. We argue about how stupid it is to tell people to do crap you don't want them to do for a few minutes. Now recall that the whole time we're having this discussion I'm lying there with a big dang plastic police baton wedged up in my business and a bladder full of aquafina. The radiologist has apparently forgotten that I came in to get my ovaries checked out in the first place because one of them has become a tiny cylindrical torture machine. And the stupid bee puts her hand on my abdomen while she's talking, pushes the wand further into my downstairs, and in a burst of sudden, excruciating pain I pee all over her. She squeals in surprise and like 4 orderlies come running in, none of them bothering to shut the door behind them. So there's a busy hallway full of people with a clear view into the room. I'm still going like a water hose. The radiologist is drenched in urine, and to top it all off there's a goddamn ultrasound wand sticking out my laddie hole. Kodak. Freaking moment. When I was younger I went to the doctor, and I'm not sure why but he had to see my dong for some reason. So I took off my pants and upon seeing my junk, he frowned, looked up at me, back to me junk, and frowned again. Great way to start a career of phallic disappointment. I was just getting over the first trimester nausea when I went in for the Down syndrome screen, which involves a diabetes-like finger stick and an ultrasound. I'm sitting on the ultrasound table and the nurse pokes my finger, gets the blood sample and slaps a band-aid on it. As I'm waiting for the ultrasound due to arrive, I notice a smudge of blood on the towel covering my midsection, and quickly discover that my finger has saturated the band-aid with blood and is oozing out the sides. I don't do well with the sight of blood, so I start to get lightheaded, shaky, and nauseous. My fiance has just enough time to get a trash can next to me before I puke up my breakfast, and as an added bonus I puked so hard I pee myself. The tech walks in to find me covered in puke, pee and blood, and all I could say was I had an accident.